And I heard a lot about the stem cells research going on in the US, and many people are taking treatment. And does University of Calgary or the Foothills Hospital or Alberta Health Services, anybody is planning to do stem cells research into the area of the back pain, leg pain, whatever, all the pains?
Dr. Swamy, yes.
I can start with that. So, I think the area of stem cell treatment, the clinically available stem cell treatment right now is really controversial, I would say. And I'm not sure that, and you can see that from what we heard today, that back pain is this big black box, a lot of things inside that black box. So when you say stem cell treatment for back pain, I think it's much too nonspecific. I don't think that it's anywhere near being ready for any clinical trials here in Alberta. So I would approach that with a great deal of caution.
Very good. And from this side of the room, was there? No? Okay. Oh, yes, Dr. Wood, yes.
Okay, first off, thank you to all our panel. Thank you. First, I want to thank everybody on the panel for helping us today, and I appreciate everybody for coming as well. I have first Dr. Boyd, wherever he is. Oh, you're here. Can I ask you a quick question? On the, for the Mobility of Life program, is there an age range that you can have for, you can just tell me and I'll tell them, because I've had a few people wondering.
We're looking at 10 years old and up.
And any top age?
No top.
So 10 years of age and up, because my aunt was wondering if she was too old, and I said, I don't think so. Okay, so please, on the table, these are the forms. If you want to sign up, you can leave it with them. Okay, now my next question is, I was wondering about the exercise map for the GLAD back program. Is that available anywhere? And also, if somebody wants to not go to Edmonton, is there a place in Calgary that they could sign up for the program?
Yes, we have clinicians all over the province in the major centers, out in the Banff corridor, up north as well. So you can access that information through the GLAD Canada website. It should be up there. And certainly if you have any trouble with that, you can find me at the University of Alberta website and contact me directly, and I'd be happy to help you.
I guess this could be to any of a number of you, but does the way you sleep affect your spinal health, like your neck, for example, or lower back?
Who would like to?
I can start. So what is interesting is that all of us gain height a little bit at night. This is a little known fact, but the disc actually imbibes water over the course of nights. So I'm not answering your question. I'm just presenting a fun fact that we actually get a little taller when we sleep. And my guess is that the way you sleep does not affect your long-term or short-term back health.
Anyone else? Yeah, okay. Another question from our audience here? Looking lovely. Our volunteers, we'll bring the microphone around. So just to be clear, Dr. Swamy is not telling you which way to sleep. Yes.
That's a very personal thing.
Yes,
yeah.
very personal, yes.
My name is Kim McNeil. I'm a certified yoga therapist. I'd like to start by addressing Kimberly. I, too, spell my name with 2 E's, so I feel like we're kindred spirits. I also I didn't know that you had little spikes on your gloves and luge, so I think that's also really useful for yoga because we slide a lot on our mats, so I think there's dual use there. But I guess my question really, in general, maybe for Greg, is that as a therapist in the yoga industry, it's hard to get teachers to really get the training that they need to be able to work well within the medical field. It happens the other way. So oftentimes you'll have physios or nurses that have the yoga training and they incorporate it in. But the other way, it's kind of a mishmash. I'm a very big critic of the industry, my own industry, and I really feel like there's an opportunity there to improve the quality of the teachers that are out there. So I wondered if you had an opinion or any insight as to how teachers could get that training, because I'm asked about it a lot, right? There are good people out there that want to do good work and support what you do, and then there's the, excuse the expression, but there's like the mess on the other side of it. So I wonder what you think.
I can't speak to the regulatory or training aspects, but I know that it's a very big topic at NIH, the U.S. Institute that looks after health research, where there's a whole institute that looks after complementary and alternative health, and yoga is a very big research topic in the area. So I've been very impressed with the quality of research that's been done in that area, and I think it's only going to help us see how yoga can benefit others throughout the years.
My question might go on this question, but Greg, when you trained clinicians for the GLAD program, you used chiropractors and physiotherapists. Why did you not consider exercise physiologists and kinesiologists, as they are the exercise professional?
Yeah, great question. The start of that comes from the GLAD people themselves, who own the copyright for this product, for lack of a better term. And as those professions aren't as prominent in Denmark, they really didn't make inroads for those professions. Now that the program is expanding into other areas, we're seeing that they're being more lenient in that certification and who can teach GLAD in other countries, as sometimes the professions who are traditionally part of it through the Danish model aren't as available. So we're seeing, I think, in GLAD hip and knee now, they've expanded in some cases to other practitioners that you mentioned, and I think we'll see the same thing as GLAD back rolls out. But in a pilot stage like this, we've basically wanted to test what was taken from Denmark as is, and then fine-tune it as we move along.
And where did that microphone go? Oh, there we go. Perfect, thank you.
Sorry.
Yeah, lovely.
My name is Andrea, and I'm a certified athletic therapist. And we deal big time with exercise, and also people don't know, but we do a lot of assessment and stuff like that. And one thing I was wondering is, I see a lot of environmental factors that wasn't really addressed today, like sedentary lifestyles, people sitting at computers all day, diet is another one. So I'm just wondering if anybody can address those situations.
So when I talked about the spine access initiative, for example, that was a specific project around how do we get that quick assessment done, and recognizing that part of the broader solution rests in what you're talking about. So as we start thinking about how do we lower the numbers of people that are actually coming for that are presenting with low back pain, how do we address that? It's through the things that you're talking about. So I think that's some of the future work that we have, and I think that there's pockets of success all over Alberta and elsewhere around education or promotional material around stay active, get active, and here are some supports to help you do that. And at the same time, we don't have that canned sort of product. So not that everything has to be a canned product, but to try to come at it from a provincial standpoint in terms of saying, what are some of the key messages and how could we do for prevention? Something similar to what Greg explained is happening for GLAD. So how do we package some of that prevention through good evidence and recommendations and feed it out so that it fits into healthy living or keeping Albertans moving type of themes?
And are you going to be going into the workforce? Because I think we can educate the employees, but sometimes I feel like the employers, like giving them breaks and things like that, we're not addressing that aspect.
Yeah, I think in the global answer would be yes. We don't have a specific, March of 2021, we're coming to all employers. So it's definitely on the radar. People have talked about the value of getting employers educated as to the value of keeping their employees active. So we haven't solved it yet, but it's definitely in the grand scheme of, okay, what are some of the next steps and what are some strategic partnerships? Where are there opportunities to actually get the messages out and to really make a difference, to go beyond just the catchphrases and to actually have things in place that support workplace wellness or physical activity, etc.
And I just have one more question with regards to Dr. Trang. So obviously medicinal marijuana is like big on the radar right now, and you talk about opiates and how they're trying to kind of like become unaddicted. And so what are your thoughts on that? Because I have a lot of patients that ask me a lot of questions about it, and I do have a medical doctor that I work with. So I'm just wondering what the future is with that.
Well, that's a million-dollar question. It's obviously a very touchy subject, but a very timely subject as well with legalization of marijuana. I'll just say that preclinically there's some evidence for possible benefits, but that's preclinical data. There haven't been a lot of well-run randomized clinical trials, so it's really hard to say whether there is definitive sort of evidence, and it would probably also depend on what type of chronic pain condition you're looking at. So I would still say that there's no magic bullet right now, and only time will tell, and that will rely or depend on properly conducted clinical trials.
Yes, at the very back.
Hi, just would like to thank everyone involved in putting this event on. I'm not sure who's positioned to answer my question best. I'm wondering, I've just read about some work that's being done in Russia using lasers at very deep levels to mobilize the body's defense systems around both reducing inflammation, but other, healing mechanisms that our bodies have. Anyone able to respond to that?
I certainly haven't read any of the literature out of Russia using lasers, but I would proceed cautiously, as Dr. Swamy said about stem cells. I think there's a lot of gimmicks out there that promise relief from your symptoms without much evidence or structured trials around them. And I would be very careful if you have to use your hard-earned money to pay for these things. I would certainly talk to your doctor about your specific situation before dishing out a lot of money for them.
Hi, thank you. I'm a Pilates instructor, so along with the other fitness folks over here, it's so good to see the exercise component so high on there. I actually attended the Frank Sir Legacy lecture just quite recently, and that was definitely a topic in the osteoarthritis, and I first heard about GLAD there. For the other people who are asking, you have to have your CSEP. So if you're even working in your kinesiology, you can challenge or get that exam, and then you can get into GLAD. Because I looked at it as a Pilates instructor, I'm not qualified yet, but GLAD is amazing. So my question is more, I guess, for Kimberly, because I dealt with chronic pain with an ankle injury, and hearing your story was completely in line. So what was the most effective, like hearing you do Pilates, like made my heart sing that you're using that as your rehab, but what was the most effective rehab? Because I'm struggling with not being able to dance and not being able to do activity, and it's debilitating. Like you get depressed, and when you're a high performance athlete, it's even harder. But for the average person, what is the most effective thing to help combat until you can get back to your activity? And then I also would love to hear from our amazing chiropractor. It's great to see such diversity on the panel.
For sure. So honestly, I did a bunch of different things. I had my team around me, so I had like the physios and everybody working with me. But I would say like try not to get fixated on what you can't do and try and do what you can do. Like I couldn't do a lot of things with my back a lot of times, but swimming was the one thing I've always been able to do and I've grown to love. So just unweighting the body, doing that, and even if you can't do that, you could just find low impact sports and low impact things that kind of enable you to do it. Yeah, it's a hard one because you kind of have to find what works within your life and what you're happy with, and find things outside of the activities that you used to do, like pick up another hobby such as painting or things like that. So does that kind of answer your question? Okay.
Sorry, I was just going to add more broadly, like in our patients, I think what you brought up is swimming and low impact activities are really probably the best sort of care for or exercise for patients with really bad backs, especially as you age. You know, impact activities are bad. Swimming seems to be an excellent form of strengthening and aerobic activity and something that everyone has access to and can do.
And just be one at the back, and I know we have a lot. I'm just wondering, where is the other microphone? Just so I, oh, there we go. Okay. So we'll start at the back, then we'll come here, and then that microphone, if it could kind of make its way a little up to the front. Thank you.
I have a question for Dr. Cadet. Are you transferring your father's records into your research model here in Calgary?
The short answer is no. He's a retiring urologist in Toronto, actually, and I use that as an example to illustrate what traditional medicine has done in the past. The relationship between a doctor and a patient was always kept in a confidential file between those two parties and shared with other doctors as needed. But my big approach to this problem is to make that data available to the people who really need it, which is you. You need to learn what other people have done in the past. And certainly confidentiality is very important, and I don't propose that we share names and birth dates and things like that. But to share the story of your medical encounter through an encrypted platform is my plan. But no, I'm not going to go scan all of his charts and put them on a digital platform.
But it really is the new frontier, isn't it?
Yeah.
It really is. Can you maybe just quickly speak to, sometimes we hear AI and we have a certain thought, but maybe just a comment about that new frontier and how beneficial that is for the work you're doing.
I think some of the technologies that we're using in my research group and with the University of Calgary Spine program have been available for less than 10 years. And some of the packages, some of the computer programming packages have been designed in the last 6 months. So this is really a new frontier, and our ability to manage large volumes of data in a secure way is a relatively new thing, and we're taking advantage of these programming packages in order to deliver information that you need and that you may want to help make decisions.
Hi, I'd like to know a little bit more about the use of biphosphonates to treat osteoporosis in order to improve bone density. In the long term, do we significantly improve or reduce fractures I know we're trying to improve bone density, but does it significantly reduce the possibility of developing bone fractures? Does anyone want?
Dr. Stephen Boyd to answer that.
If I summarize the question, can we use bisphosphonates to improve bone density in terms of spinal fractures? So absolutely. Bisphosphonates are a very well-proven pharmacological treatment for osteoporosis. It's not going to be a magic bullet, but it is something that probably should be taken as a a way of preventing further deterioration of the bone structure and ultimately preventing the fracture. What was that another part of your question?
I know we're trying to improve bone density, but do the studies prove that we are significantly reducing the possibility of getting bone fractures as we age?
So
do they demonstrate that?
The short answer to that is yes. So there is reduction of fracture by using bisphosphonates, and there are other anti-osteoporosis drugs out there as well. And with aspect to the spine is actually a little bit challenging in terms of diagnosing those fractures, but still we show a decrease in fractures after the use of a bisphosphonate.
Now, I know we'd love to stay and ask many, we only have time for one more. So where are our microphones here? Here, oh, we've got one right there. Okay, thank you.
Thank you for all this information. I have a question around the Alberta Tomorrow project. You're talking about collecting data, and you have your own database. I'm part, and probably many of these people signed up for the Alberta Tomorrow project, and they took saliva samples, blood samples, and it was a longitudinal study to help research. Are you collaborating with them, or are you developing your own database?
Yeah, that's a great question. That's a really important point. Certainly we are developing our own database, but one of the most important features about our database is that we can share information and accept information from other databases. I think the notion, and I have to say that coming from Ontario, I think Albertans are very lucky. I think the system that's being developed in Alberta, the provincial records system, is incredible, and that's a very sophisticated database that contains a lot of information. We're not trying to replicate that, but the reason why we're creating our own database is because we have specialized knowledge about specific spine problems. So the provincial databases capture everything about you, but it's hard for me to tap into that and write a machine learning algorithm to answer a spine question. I need more versatility in the programming abilities, and I need to use information in different ways. So there will be many databases that will be developed in the next 10, 15 years, and ours has a specific goal, and that goal is to deliver you personalized information about your spine problems. The goal of the provincial databases are to capture everything about you so that doctors can use it on an emergency basis or on a longitudinal basis. And there will be many other examples. So data sharing agreements are important, and guidelines and handbooks about how we use that data and what the purpose is. So don't think of a database as an isolated entity. Think about it as having a purpose, and sharing is important. Sharing data is important.
Well said, and I'll just pick up on that. Sharing is so important. It's how we learn, right? Knowledge is power, how we learn and can apply it to our own lives. And how wonderful that we have these experts, these researchers working on this for us, and how we are able to connect to them here today. And I think all of you can definitely join me in a round of applause, first of all, for our wonderful intel. Yes. And to know that this cutting-edge research, world-leading research, is happening right here in the great city of Calgary, in the great province of Alberta. And I just also want to share with you that if you would like to